Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Before I get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been muted so you can hear our guest speaker today. If you have any questions for our guest speaker, you may use a chat feature, which is located at the bottom of your screen. We'll have time for in the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I would like to introduce you all to today's guest speaker. Joining us today, we have Dr. Shraddha Damaraju. Dr. Damaraju is an internal medicine and primary care resident at Mass General. She has led opioid overdose prevention initiatives in many different settings, including working at the Philadelphia Department of Public Health to create a citywide naloxone training program in partnership with community organizations in overdose hotspots neighborhoods across the city. She is passionate about community health and health equity and plans to practice a mix of primary care, addiction medicine, and public health after residency. In recognition of Recovery Month, she joins us today to give a talk on opioid overdose awareness and reversal training. So please join me and welcome Dr. Damaraju.
Hi, everyone. Thanks, Amy. Thanks, everyone, for joining me. I'm just going to share my slides. Okay, great. So today we're going to talk about opioids, what naloxone is, how to recognize an opioid overdose, how to use naloxone to reverse an opioid overdose, and hopefully we'll learn a lot. So before I go into any of the other stuff, just a brief overview of what opioids are. So opioids are a class of chemicals that produce signals in the brain that are interpreted as pain relief. And your brain has naturally occurring substances called endorphins that have the same chemical structure or a similar chemical structure. So opioids are another version of that type of chemical. And so the way I like to think about opioids is there's different kind of buckets depending on how they're made and how they're obtained. And so there are opioids that are just naturally occurring. So I have a picture up here of poppy seeds, which contain naturally occurring morphine, which is then, undergoes a chemical reaction to create heroin. And there are other opioids that are just completely synthetic, meaning that they're just made in a lab. And so a lot of pharmaceuticals are that way. Also, a lot of illicit fentanyl, which we're going to talk about, is that way. And then, of course, there's overlap. So there are semi-synthetic opioids, for example, heroin, like I talked about, that requires a naturally occurring substance, morphine, and then requires that chemical reaction to make it into something else to purify it. There's also differences in opioids depending on how they're obtained. So, of course, there are many opioids that are prescribed by providers. So, OxyContin, MS-Contin, Dilaudid, there's a lot of different prescribed opioids that help people with their pain. And then there's also similar versions of those that are sold illicitly on the street or through the drug market. And there is also overlap here. So you can get or you can find, something like oxycodone might be prescribed, but it also might be illicit and available, on the street. And there are important differences that we're going to talk about, namely when we talk about fentanyl. There are things to consider when, you know, someone is obtaining illicit drugs, you know, a lot of cross-contamination with things like fentanyl. That's a very dangerous opioid. Yeah, so that's just kind of a big summary of what opioids are. So how exactly do they doses? So the way opioids work in the brain, in addition to reducing that sensation of pain, they also act on parts of our brain that reduce our ability to breathe, especially in higher doses. And so when someone takes a lot of an opioid, that drive to breathe goes down. And then so eventually their rate of breathing slows down. When your breathing slows down, your brain doesn't get enough oxygen. And when your brain doesn't get enough oxygen, your heart stops. And so that's the pathway through which overdoses can cause death. And that's actually the pathway through which we can reverse an overdose as well. We can help someone breathe. So naloxone or Narcan. So I'm going to be discussing Narcan, which is this nasal spray version of a medication called naloxone, which is the generic medication. It's a drug that reverses the effects of opioids in the brain. This is a picture up here of how that happens, but basically, in order to tell the brain, you know, what to do, those pain relief effects that affect on breathing, opioids latch onto these things called receptors in the brain. And so what naloxone or Narcan does is it goes to that same receptor and knocks off the opioid and stops both the pain relief effect and the effect of not breathing. And so it basically reverses the effect of the opioid. And there are different formulations of it, and we're going to talk a little bit about some of the others at the end. But the main one that we're going to learn how to use today is this intranasal spray. And everyone should carry it. Everyone should know how to use it. It's as important, or if not more important than CPR, and it's just a tool that everybody should have, especially in these times. So just to give a high-level overview of why this is important, why we need to learn this, and why everyone should be talking about naloxone. Overdoses have just greatly increased over the past, 20 years, as you can see on this graph. In 2022, 2,357 people died from opioid overdose in Massachusetts. That is a huge number, and it's also the highest it's ever been. And also, I just want to point out the fact that there are really significant disparities among racial and ethnic groups in terms of overdose deaths, namely that Black folks, Hispanic folks, and Indigenous folks have had higher increases in overdose deaths. And also just pointing out that Indigenous folks have just a higher rate of overdose deaths in general. And so why have overdose increases so much? So there's a lot of different reasons, but the biggest thing that we're going to talk about today is the arrival of fentanyl. Fentanyl is a very powerful opioid that came onto the market and basically has caused overdoses to skyrocket. So you could see right around 2015, 2016, before the leading cause of opioid-related deaths used to be heroin. And then right around here, fentanyl really took off. And now fentanyl is the reason why most overdoses are happening, because it's kind of cross-contaminated or adulterated into everything. And we're going to talk more about why. So like I mentioned, so fentanyl is a very powerful opioid. It's up to 50 times stronger than heroin. And it's important to know that there's not just one type of fentanyl. There's multiple different, we call them analogs. So fentanyl is really just like a bucket term for a bunch of different chemicals that all have a similar structure. And so there are two types of fentanyl, like we talked about before, with those Venn diagrams. So there is fentanyl that is pharmaceutical. And so that fentanyl is, made by pharmaceutical companies. It's used in the hospital setting, namely for anesthesia, for pain control, and it's used in, small doses. That fentanyl is different than the fentanyl that we see on the street or the illicit fentanyl, which is just extremely strong and put into a lot of different drugs, not just opioids. So these vials right here, and this is a dime for comparison, so these are very small vials, show a lethal dose of each drug for somebody who's never had an opioid before. And so for heroin, it's a very small amount, but it's kind of coating the bottom. That's how much would produce an overdose, would kill somebody who's never had an opioid before. Fentanyl, you can see, is like a fraction of that amount, just like a few grains could cause an overdose. And then carfentanil, which is not as much of a problem in, our part of the country, is an even more powerful opioid that's, much stronger than fentanyl itself. And that visual representation right there, just like a very tiny bit, can cause an overdose. And just to put it out there, because there's a lot of myths about fentanyl, it's not naloxone resistant. So the way that naloxone or Narcan works, like we showed in that picture, is that it comes down into the receptor and knocks off the opioid. And so fentanyl, it's not naloxone resistant. You just may need a little bit more naloxone to actually, it's a stronger opioid, so you need more of the reversal antidote basically, but it's not naloxone resistant. Also, illicit fentanyl is not made to be absorbed through the skin. So if you touch it, you can't overdose. That's a myth that's often out there. That's not true. So why are we seeing fentanyl in the drug supply? So the biggest thing is that in relation to heroin, which, like we talked about, is semi-synthetic, meaning that it needs the morphine, you need the poppy plant, you need to kind of purify it and then do that chemical reaction. Fentanyl is completely synthetic, so it can be made in a lab, and it's just a lot cheaper to manufacture because of that. It's a lot logistically cheaper to manufacture. It's also a lot more potent, and so that's why it's in street drugs, because it can kind of get people hooked faster. And it's just shown up in not just opioids, but it's shown up in meth and cocaine and just a lot of different drugs that are it's safe to assume that it's in everything. And that's why it's really important that no matter what, if you are using in an illicit drug, it's important to have Narcan or know how to use it, know how to access it. And just a quick aside that there are reports of, if somebody buys something like they think that they're buying like oxycodone off the street. Sometimes fentanyl powder is taken and it's pressed into pills. And so it's not actually, a lot of people don't get what they think they're going to get. And so it's really important to be aware that everything could have fentanyl in it. So how do we prevent or mitigate the risk of overdose? So in a nutshell, all of these strategies are harm reduction. So we're reducing the risk of overdose and reducing the risk of harm from using opioids. So the biggest thing is if somebody is going to use illicit drugs, to not use alone if they can help it. This is because, somebody else can be watching you. Someone else can just make sure that, if something goes unexpectedly or something goes the wrong way, there's someone else who's there as a support who can call EMS. And I put this number up here, Never Use Alone. This is a wonderful organization. This is their hotline, 1-800-484-3731. So this is a number that if you call, from anywhere, and you say, hey, I'm about to use this drug, and they will stay on the phone with you. And if they don't get a response from you after you've used the drug for like a certain amount of time, then they will activate local EMS to come and check out the situation. So it's really just a safety net so that someone else knows, what's going on, and using alone is very dangerous in the age of fentanyl. The other thing that's really important is to not mix drugs. So, mixing different classes of drugs, for example, not mixing benzos with opioids, or not mixing opioids with alcohol. So, all of those drugs cause respiratory depression, like we talked about, so they reduce your ability to breathe. And so mixing different types of drugs is dangerous, and the best thing to do is use individually, and starting small with small amounts and using slowly to see what the effect is before using a larger amount. Also, it's really important to start at a lower dose if it's been more than 48 hours since the last use, or if you're getting it from a new source, for example, a new dealer, just because the concentrations of these things can vary depending on where and who you get it from. So it's always, you can always start slower and go up, as opposed to, starting higher and then getting into a bad situation. The 48-hour rule is important because it only takes 48 hours for the body's tolerance, which is basically how much of the drug it needs to have a certain effect. That tolerance will go down. So if you think about it like coffee, if you are used to drinking like 2 cups of coffee, and that keeps you awake in the morning, and then you don't drink coffee for a while, if you go back and you drink those 2 cups of coffee, your body has, gotten used to a less amount of it. And so you're going to be super, super jittery. You're going to have all the negative effects from it. So it's kind of the same principle. So it's important to start at a lower dose if it's been a period of time before the last use. And it's really important to have certain tools, or to know about certain tools to prevent overdoses. So we're talking about naloxone or Narcan today. There are also fentanyl test strips, which we can talk about how to access them, and in a later slide. And this is basically how they look. They're basically little strips that you would use into the residue of whatever you're mixing. And if there were 2 lines, that means there's no fentanyl, and just 1 line means there is the presence of fentanyl. It doesn't tell you how much, but it's important to know if it's there, and if it's there, have Narcan on hand, things like that. So there are online trainings. There's an entire, this could be a whole other talk, how to use fentanyl test strips, but just know that these exist and they're accessible for anyone who needs them. And then harm reduction supplies are really important, not just to prevent overdoses, but to prevent the harmful side effects of using drugs. So, for example, fresh syringes, unused syringes, and sterilized supplies, things like that, reduce the risk of infection. And so they're really important to have and to know about. So we're going to talk at the end about some organizations that hand out these things. So briefly, just a quick, before we talk about how to recognize and respond to an overdose, I just want to ground us in, what naloxone does to the body, why it's safe, and also why it does have side effects that you should know about. So naloxone only works for opioid overdoses. So for example, if somebody has overdosed on a benzo, giving naloxone is not going to reverse that overdose, because there's no opioid that's causing that overdose. But with a caveat that if there's no opioid in the body, naloxone has no effect. So for example, right now, I don't have any opioids in my system. If I were to take a dose of naloxone, nothing would happen. So it's safe to use. It's really important to know that. It doesn't work on other drugs. Xylazine is also another drug that we see a lot of on the street nowadays, that causes, similar respiratory depression and can kind of worsen the effect of an opioid overdose. So, but it's, like I said, in the age of fentanyl, it's important to assume that it's in everything. And if there is a component of an opioid, for example, fentanyl, that's causing part of that overdose, the naloxone will work on that part of it. So to somebody who's unresponsive and not breathing, it's never wrong to give naloxone. If the opioid is not the cause of them being unresponsive and not breathing, it's okay. Naloxone is not going to hurt them. But if you know that they've used opioids and you know it's an overdose, opioid overdose, you definitely want to use naloxone. But it's really important to know that it puts people into instant withdrawal. And so we want to be, for somebody we want to make sure that they're actually unresponsive before we use it, because putting somebody into opioid withdrawal is very, it has a lot of bad side effects. So withdrawal is, a combination of just tons of side effects: cold shakes, chills, sweating, fever-like symptoms, mood swings, vomiting, diarrhea, bone pain, insomnia, just a lot of negative effects. And the way naloxone works, it's kind of reversing all of those, all of that pain relief that the opioid has produced. It's reversing all of it at once. And so just to put a quote up here, receiving Narcan feels like instant withdrawal, but the worst withdrawal you've ever felt in your life. Like you feel like your legs are broken, your head's screaming. So I just wanted to incorporate that perspective because I think for people who have experienced Narcan before, it's a tough experience to go through. And so it's really important that we are using it in the correct way, but it's also really important to know that it's safe to use. So this is a helpful kind of division for when somebody would need Narcan versus not needing Narcan. So there's a difference between somebody who is intoxicated or somebody who's high and somebody who's overdosing. So the biggest difference is, are they breathing or not? So with somebody who's intoxicated, their breathing is slow, but it's deep, and their skin looks a normal color. They're drowsy, but if you kind of call them or if you shake them, they're responsive. So they might be, sleep, like they might look like they're sleeping, they might look like they're falling asleep, but they're responsive to you, and they don't look like they're not breathing. So that person doesn't need Narcan. And if you give Narcan to that person, you're putting them into instant withdrawal, horrible side effects, and that's not appropriate. But when somebody is overdosing, when somebody is not responsive, like I said, it's never wrong to give Narcan. So with someone who's overdosing, their breathing is shallow or gurgling, or it's just not there. And they have the signs of low oxygen on their skin. So if they have lighter skin, their skin will kind of turn bluish. And if they have darker skin, it'll kind of turn grayish. A really good place to check for this is around the lips, and then also at the nail beds. Those are kind of skin areas where they turn hypoxic or low oxygen first. And the person is, more importantly, not responsive. And so in that situation, naloxone is important to give. And there are also some considerations for in the age of fentanyl. Sometimes fentanyl overdoses can look a little bit different. Because fentanyl is so potent, a lot of the times if someone is using fentanyl, it'll cause an overdose immediately. And so somebody will, immediately become unresponsive right after they use a little bit. And sometimes people can get rigid. Their muscles can like kind of lock up. And that's kind of unique to fentanyl. It's important to, if you are around somebody who is using and you want to just like check and be on the safe side, you can get one of those pulse oxes from, the pharmacy or Amazon. They're relatively cheap, and you just put it on their finger and it'll tell you what their oxygen level is. If their oxygen keeps going down, then we get worried. And if they become unresponsive, if they stop breathing, that's when you give them Narcan. So how do we actually determine if someone is unresponsive? So you can kind of follow a cascade of things. So first you start with verbal stimulation. So first you ask really loudly, hey, are you okay? You can kind of clap in their ear, make loud noises. If they don't respond to that, the next thing you can move on to is a light touch. So, you can shake their shoulder, and you can kind of try to arouse them that way. If they still don't awake, you can move on to a painful stimulus, and that's usually, if anything, that's what people will wake up to. And so a lot of EMTs will use a sternal rub, which is basically where you take your knuckles and you grind it into the breastbone. It's uncomfortable. And I would recommend for just like the lay person who's not a medical professional actually to use what's called a thumb press, because it kind of, it allows you to keep your distance from them, and in case they like jump up in pain. So a thumb press is basically you take your nail and then you dig it into the bed of their nail right at the tip. If you try it on yourself, it's pretty uncomfortable. And so that's a painful stimulus that if somebody is not responding to, then they're unresponsive. Also, just a caveat that if somebody is obviously overdosing, for example, if they're blue, if they're not breathing, if you can just if you can tell that something's very off, you don't need to do any of this. Just go ahead and move on to the next steps. So the most important thing to do, so you can follow this acronym CARE, which we're gonna talk about, all the different steps for responding to an overdose. But if you get nothing, if this is too overwhelming, the most important thing is just to give them naloxone and call 911. It's important to call 911 because if it is an overdose, they can bring more naloxone. If it's not an overdose, they come with all these medical tools and medical knowledge, and they can really determine what's going on, and they can get them to a place that's more safe. So the first thing you want to do is call 911. And this kind of varies by where you are, but sometimes there are reports of because of stigma against people who use drugs, sometimes EMS takes longer to get there if they know that it's an overdose. It's really messed up. But it's important to just say, my friend is unresponsive and not breathing. And that, that kind of covers the situation. The next thing to do is administer naloxone or Narcan. So how do we do that? So naloxone or Narcan, the version that we're talking about right now, is a nasal spray, a single spray up into the nose. And so you put it up into their nose and then you pump once, and that's it. And it has a plunger in it, and it's going to deliver all of the naloxone directly to the brain. It's not like a Flonase or something where you have to pump multiple times. And it takes 5 minutes to work. So if there's no response after 5 minutes, you can give another dose. But if you're responding to an overdose, these 5 minutes are going to be like the slowest 5 minutes of your life. But it's important to give them that time, because sometimes it takes up to 5 minutes to work. I've seen people pop up in like the last 10 seconds before we were about to give another dose. And it's important because the more you want to kind of give the least amount that's possible to reverse the overdose, because the more you give, the more withdrawal symptoms you're producing. And so one way to kind of keep time is you can kind of look at when you called 911 and keep a log of like when the length of that phone call is around 5 minutes. That's kind of when, if they haven't responded, you can give them a second dose if you have it. You can also use someone else if you're responding as not just a single person. Someone else can kind of keep the time, but it's important to give it that time to work. In the meantime, while it's working, the best thing we can do for this person is rescue breathing. And I want to give this a huge caveat that in the age of COVID, please assess your own COVID risk and do this, do this if it's appropriate for you and if it's safe for you. And if it's not, that's totally fine. So the importance of rescue breathing. So like we talked about, the thing that's driving the overdose is their inability to breathe. So while we're waiting for the naloxone to reverse that effect in the brain, we need to breathe for them to give them oxygen. This is different than CPR for cardiac arrest. So when someone's heart stops, CPR, it's no longer recommended to do rescue breathing. What's more important is doing the actual compressions. This is a totally different pathway. So while the naloxone is working, we can breathe for them. And the longer they don't breathe, the longer they don't get oxygen, the worse the outcome could be, because their brain is not getting that really important oxygen. So you can use the chin thrust to tilt up their airway, like shown in the picture. So you tilt their airway up, and then that kind of opens it up here. Sometimes before, depending on the situation, if this is safe for you, you can take 2 fingers and just kind of sweep their mouth, because sometimes people might be like sucking on candy or something like that. Sometimes when the drug hits the bloodstream, it produces like a sour taste. So sometimes people will suck on candy. So we don't want to rescue breathe if there's something in their mouth that could get lodged in their throat and they could choke. So check for that. So the way to rescue breathe is 2 strong breaths every 5 seconds. And so you put your mouth over theirs, you kind of make a seal, and you breathe twice strong every 5 seconds. And you don't have to do mouth to mouth. There's a lot of different barriers that you can use. Let me see if I have mine actually. So there are different like face shields available. And there are, you can even use a mask. You can breathe through a mask. You can also breathe, you can lift your shirt up and breathe through that. So just create a barrier between your mouth and their mouth and breathe for them, and watch for their chest rising to know that your breath is actually going into the lungs. But like I said, huge caveat to do this at your own comfort, and evaluate your COVID risk before you do this. So this is an example of a single-use CPR face shield that you can kind of get at the pharmacy or Amazon. And so there's a mouthpiece here, and then this would go directly over their mouth. And then there's a barrier here between your mouth and their mouth. And so this is something that you could use. You would basically like put this over their mouth and go, and then count to 5, and then do it again. So that's how you do rescue breathing. And so while you're doing all these steps, so far we've called 911, we've given them naloxone, and we're timing 5 minutes. And in the meantime, if we're comfortable, we're doing rescue breathing. During all of this, we want to evaluate and see if the person has actually responded to our intervention. So things to check for. It's basically the opposite of the signs of an overdose, right? So if someone has turned blue or ashy or gray, or they look like they don't have oxygen, see if that color actually comes back. See if their chest is rising on their own, and you can put your finger in front of their nose or mouth and feel if they're breathing themselves. If they don't respond after 5 minutes, like I said, give another dose of Narcan, but you want to just kind of check intermittently while you're doing this, just check for these signs of someone returning back. And if they do, it's really important to put them in the recovery position. Like I said, one of the symptoms of withdrawal, which naloxone is putting you into instant withdrawal, is vomiting. And so you don't want that person to vomit on their back. They will aspirate, they'll go down the wrong pipe and they'll choke on it. So you want to put them on their side into this recovery position, and the picture is right here. So overdosing and receiving naloxone, we've talked about all the effects it has on the body. It's a traumatic experience for that person. So we want to be, when that person comes to, we want to be trauma informed in the way that we talk to them, in the way that we discuss what happened. It's like they are waking up with the worst feeling in the world. And so it's really important not to crowd them. Really important to approach them with care and love and no judgment. Understand that they are just feeling absolutely horrible, and so strong reactions are possible and understandable. People can get really upset after they receive Narcan, and so it's also really important to maintain your distance and your safety, and don't put yourself in an unsafe situation. But if you have a chance to explain what happened, you kind of tell them, hey, I saw that you were unresponsive, and so you weren't breathing, and so we gave you Narcan. And there are certain safety tips that are important if you have a chance to talk with that person. It's important to know that Narcan doesn't last as long as the opioid does in the body. So for example, if someone has taken a lot of fentanyl and they overdosed, and then that overdose was reversed with Narcan, that Narcan is going to wear off faster than that fentanyl. And so it's possible that they could go back into an overdose, especially if they use on top of it. And so it's important to try not to use for a few hours, but like I said, this is traumatic for that person and they are in instant withdrawal. And sometimes the only thing that they're going to want to do is use more, and that's understandable. If in that case, it's important to try to advise them to stay around other people if they're comfortable with that. Or if you have any extra Narcan, give it to that person. But just really take into consideration that, this person has experienced a trauma, and it's really important to give them their space and approach them with love and care. And also just a big tip that not everybody wants to go to the hospital after they've experienced an overdose. A lot of the times hospitals are extremely stigmatizing and places of abuse for people who are experiencing a substance use disorder. So if someone doesn't want to go to the hospital, it's totally okay. So how do we get naloxone? So across Massachusetts, there's what's called a standing order, which is basically a statewide prescription for naloxone. So anybody should be able to walk into any pharmacy and get naloxone without a prescription. It could be a private pharmacy, it could be a commercial pharmacy like CVS, it doesn't matter. Any pharmacy should be able to give you naloxone, and most insurances cover it as well. But the price depends on what your insurance is. So you're gonna have to go to the pharmacy and ask what the copay would be or what the cost would be with insurance. And there's also programs all across the state that offer naloxone for free. They distribute it. So on mass.gov, if you just Google mass.gov naloxone distribution program locator, these are all of the locations in the state that provide naloxone. And so you might be wondering, what are the legal protections for responding to something like this? And Massachusetts, like many other states in the country, has a Good Samaritan law, meaning that if you witness an overdose and you respond in good faith, you and the person who overdosed are protected from arrest, prosecution for drug possession. The reason this law is in place is really to just encourage people to help other people and encourage people to respond without fear of liability or prosecution. And then just to discuss a few resources. So Massachusetts Substance Use Helpline is up there. Next Distro is a countrywide organization that can mail out free naloxone and provides just a lot of amazing resources about naloxone and harm reduction in general. A-Hope is our city of Boston's harm reduction program that provides a lot of harm reduction supplies, like we talked about earlier. Project Trust is a local community organization that provides services and outreach. PATS is also another similar organization within the city of Boston that connects people to treatment and services. And just to briefly mention that MGB has a mobile community caravan that is in different neighborhoods across the week, and on certain days provides substance use care. And the van has Narcan and can train people on the spot. And so that's also a resource that you can utilize. But it's important to know that every pharmacy, there's a statewide prescription for naloxone. So you should be able to get it without a prescription. And just to briefly talk about some tips and tricks first for just how to use naloxone and how to store it. So naloxone should ideally be stored at room temperature. Don't leave it in your hot car. Don't leave it in your freezing car. Try to just keep it in your bag, like on your person at all times. It's helpful to have anyways. And kind of protect it from the light as well. So don't leave it out in the sun. Not all naloxone. So there are different versions of naloxone. We talked about Narcan, which is the single spray nasal spray. Not all naloxone is like that. So there are different types. There's a generic type that's not necessarily spring loaded, meaning that if your head is up, if you administer the Narcan, it has a spring in it so that it's just going to go directly up, and it doesn't matter what position the head is in. Generic naloxone is not the same, so you might need to lay the person flat before administering it. So important to just like read the instructions on the type of naloxone that you have. There also is an injectable naloxone, which is, most people, healthcare professionals use it more often. And I think the easiest one to use is this nasal spray version. Also, any naloxone is better than no naloxone. There are studies linked at this Next Distro hyperlink that show that expired doesn't necessarily mean not effective. So naloxone, the drug, is stable for a long time after the noted expiration date. So if you have naloxone and it's only naloxone that you have and it's expired, still use it because there's a good chance that it'll still be effective. And just briefly going over what's in my kit. So I kind of keep everything on this lanyard, and I just kind of move it from bag to bag. I always have it on me. So I have this nasal spray Narcan. I also have gloves with me, which is important, whenever let's say you're on the street or something and you're responding to a situation, be aware of needles, be aware of, the environment, and keep yourself safe. Gloves are one way to do that. I also have a pulse ox, like we talked about. This is a good way for, just quickly checking so it kind of looks like this on your finger, quickly checking what someone's oxygen levels are. And anything less than 90 is they're not oxygenating themselves well. And then this CPR face shield that we already went over. So yeah, that's about it. Thank you for listening, and we can take some questions now.
Thank you so much. We are now at the end of the session, so if you have any questions for Dr. Damaraju, please enter them in the chat. We have a question regarding the use of Narcan. Are there any age restrictions on who can receive Narcan?
That's a good question. I don't believe so. I think it should be safe for anybody. Anyone who's taken an opioid should be able to get Narcan.
Thank you. We have a participant who has heard that the new high-dose Narcan can be more harmful than helpful. Can you share your thoughts on this?
So I think it really depends on so it's a balance like we spoke about before, where you want to evaluate the situation and determine if that person has is responsive or not. And I would argue that if someone is unresponsive, it doesn't matter if you have regular dose Narcan or high dose Narcan. If someone is unresponsive, that means that they need it. And so go ahead and give it. But with that higher dose, it does have the potential for more withdrawal side effects. And so that's why it's important to really evaluate if someone does need it. But it's never wrong to give Narcan when someone is unresponsive because that's what they need. Yeah, so that's what I would say on that.
Thank you. For a suspected overdose, should the first call be to 911, or is there a 3-digit hotline one can call, particularly for those who may not feel comfortable speaking with emergency response?
I think the best thing to call is 911 because they're going to walk you through the situation and they're going to, ask what they need to know. But they are going to provide life-saving medical care, and you might not have all the tools that you need to do that yourself. And so it's really important to, in an emergency medical situation, which an overdose is, important to call 911.
Thank you. You had covered a little bit about the Good Samaritan law. Are there any legal ramifications for a patient that they would need to worry about if they seek care after Narcan is given for an overdose?
I don't believe so. But things kind of depend. I don't know of any legal ramifications for seeking care after an overdose. We take care of people all the time in the hospital who have experienced an overdose, and what we do is we connect them with treatment and services and resources. And so I don't know of any legal ramifications. And if somebody does want to seek that care, they should absolutely do so.
Thank you. For each individual Narcan, how many doses come in each one?
So it's a single dose. So you'll basically just push it once and the whole dose will be delivered into the nostril, and then that will be discarded afterwards. So it's not gonna work after that. So it's just a single dose.
And is it safe to give a full dose into one nostril?
Yes. And in fact, you can only pump it once. And so you're really only supposed to, you just push it once into one nostril, and that'll deliver the full dose. And then you want to wait 5 minutes because it might take 5 minutes for it to work.
If Narcan seemed to have worked in reversing an overdose, should the person still seek medical attention?
So I think it's important to just because there may be other things that are going on. For example, if they hit their head, or if they have wounds, or if they have other medical things that need to be taken care of. Also, like we talked about, naloxone wears off before the opioid does itself, and so there might be a chance for re-overdose. So it's always helpful to be in a setting where you can be monitored. But like I said, huge grain of salt, because hospitals are often a triggering place for people who experience substance use disorder, and so it's really up to that person's comfort. But if they're willing to seek medical care, I think it's never wrong to do so.
And how soon should one seek medical care, especially since you covered that withdrawal symptoms will start?
Yeah, so pretty much as soon as you can. And so especially if you've called EMS, they might encourage you to go to the emergency room with them. And if the person is comfortable in doing so, go for it. And they can kind of take you to the hospital. But it really depends also on what the withdrawal symptoms are. Sometimes if people have a lot of vomiting or a lot of diarrhea, they might the hospital has the ability to kind of give medications that help with those symptoms as well. And also, if you go to the hospital, sometimes if someone's interested in treatment, it's possible to just right then and there initiate treatment right after an overdose and get somebody onto methadone or Suboxone if they're comfortable with that and if that's their preference. So the hospitals have a lot of tools and resources for this type of thing, if someone is willing to go.
Thank you. And family and friends get Narcan? And if so, is there any special training or certification needed to carry one?
Absolutely. Anyone can get Narcan. It doesn't matter who you are. There's no special card that you have to show to get naloxone. Anyone, family and friends, strangers, just anybody who wants to carry it can walk into a pharmacy and get it. And there's really no special certification. If you listen to this training and you are aware of how to use it, that's all you need. And if you forget things from this training, there's going to be a recording posted. And also there are tons of resources online, lots of videos, lots of resources on how to use Narcan. So you can always find a refresher. And I believe the company itself, Adapt Pharma, has lots of resources online showing how to use it. So definitely anyone and everyone should carry it. And there's no special certification required to do so.
Thank you.
Mhm.
If stored properly, how long is Narcan effective beyond its expiration date?
So it kind of varies by the studies, but honestly, years. So if it's just a few months expired, I wouldn't worry about not using it, especially if that's the only naloxone that you have. It's safe to administer, so just go ahead and administer it, and hopefully it's still effective, but it stays stable for years after the expiry date.
Thank you. While we wait to see if there are any additional questions, do you have any final thoughts you'd like to share with the audience?
Yeah, thank you for listening to this, and talk to people in your life about Narcan and naloxone. It's important that everyone knows what it is and knows how to use it. And we have power in numbers. And so just keep the conversations going and treat everyone with love and be non-judgmental and loving and caring, especially when someone's experienced an overdose. It's really a trauma. And so, just keep that in mind.
Thank you. And aside from what's been covered today, as well as the recording being posted on our website, are there any particular online resources that you recommend one visit to learn more?
Yeah, so I'm still sharing my screen, right? So I think this website, Next Distro, this organization is really amazing. And they have just like a ton of resources on their website about harm reduction, about naloxone, about stigma against people who use drugs, and how to stop that stigma. And so I love directing people to this organization and reading more about it. I think it's amazing, and I think everyone can learn something.
Great. Thank you so much for spending the hour with us.
Absolutely.
As we had mentioned, that today's session is being recorded. So if you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the day.
Thanks.